Hello, good morning, everybody. Welcome to the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health system design expert and thinker. I'm really excited to welcome Darrell Steinberg today, who's our guest. He has been at the epicenter of California's mental health and public policy for decades now. He started out in the Sacramento City Council in the 90s. He was in the California State Assembly in 98 to 2004. He was in the California State Senate 2006 to 2014 and was the president pro tempore 2008 to 2014. And most recently has been the mayor in Sacramento for 8 years. He also has authored the MHSA Act, which a lot of us learn about and work with in healthcare and in behavioral health. Thank you so much, Mr. Steinberg. Thank you for joining us today.
Thank you for having me, doctor.
I wanted to learn a little bit about your early life and maybe the inspiration around getting into politics.
Well, I was always one of those kids that, I was either going to be a doctor or a lawyer. And I liked science, but I didn't really have much of an aptitude for it. On the other hand, I love to read and I love to write. And I got very interested in politics from an early age. I had a formative experience as a high school sophomore where I traveled back to Washington, D.C. on a program called Close Up and met with a number of very prominent people, including Senator Hubert Humphrey, a hero of mine. And I just thought to myself, is this something I can do in my life? And as I grew, I ran for student body office and decided to major in economics and a minor in political science in college at Berkeley and UCLA. And then I went to Davis Law School, where I had another really important life experience. I became kind of a tutor and a advocate for people with disabilities, physical disabilities, severe physical disabilities. And the law school in those days both was progressive in admitting students with disabilities, but not making the entire law school accessible to them. And so we fought for a lift in the so-called moot courtroom where the rest of us got to practice being lawyers in front of judges and jury boxes and that sort of thing. And while the people with disabilities couldn't access the room, and we asked for money for a lift, and the law school promised us they would find the money, and we waited and were patient and kept working it. And finally, we went to the UC administration and said, "Where's the money?" And they said, "Well, we offered the law school the money." They turned it down because they didn't want to change the look of the courtroom. And we said, "Can we get that letter where they said that?" They said, "Sure." We got that letter and put it on the front page of a couple newspapers and got that lift built. And for me, it was my first real experience with how you use power to try to make the lives of people better. And it also was my inspiration around issues of disability, because what I saw with my friends in wheelchairs were that the flip side of disability was ability. If only we do our part to make sure that people with disabilities have a real chance, then they can live better lives. And certainly when it comes to mental health and mental illness, which became my passion, that's so true. These don't have to be life sentences of unemployment and disconnection and worse. And so that's how I started. And it led to, a long service in public life. And I've been very privileged to do what I've done.
Can you say a little bit more about, you said how power plays out in this situation, right? How does you as a student currently, how do you think about your power, the risk that you were taking in putting this out there in your own journey? How did you think through that?
Well, first of all, power does not depend on a title. The title is a means, being the senator, Senate pro tem mayor is the means, and only one means, to use power to try to pursue a cause or to help change the society consistent with your own values. But you don't have to have a title to do that. You just need to have the passion, the knowledge, and be willing to work hard and organize with others. For me, power is something to never get too heady about because it is by definition temporary and you use it. But if you use it for good and you push hard for things that matter and you choose to commit yourself over the long term, then you have a real chance to make a difference. Where you see a lot of people in this day and age, maybe in all eras, where they get involved and they realize that it doesn't go as fast as they want it to, or there are setbacks and they find themselves frustrated and then they exit from their own involvement and engagement. And that's unfortunate because there are others who stay with their cause for years and decades, and they get the privilege and the benefit of being able to look back and say, "Oh my, it was hard, but look how much progress we made." Because that's the nature of power in a democracy, especially. You find your opportunities and you forge as fast and as hard as you can. And then when you don't get all the way, you come back and you keep going. And power is all about how you use your influence in whatever way you achieve it to try to improve the social condition.
If I may ask also, I'm sure in your journey, you've run across situations, you're pushing on an issue, and somebody has told you, you may not have your role much longer if you keep doing this. So when you hear that, how do you process that?
Well, first of all, i- it's always a balance. You can't be reckless in politics. You can't just do whatever you want because you think it's right. On the other hand, if you are risk averse, too risk averse, then you will never achieve what you might otherwise achieve. And so it is a balance. I've found over time that the people, whether it's your colleagues or the voters, the public, will actually be okay with your taking risks so long as you are connected to them, so long as you explain yourself, even if they disagree with you. They will give you that room if you are present with them and if you have the right attitude. There's unfortunately our politics today, it seems like people get ahead by being kind of nasty and, calling each other out. And certainly there is the rightful place for a fight, a real fight over things that matter. But I will tell you, you'll win more fights if you try to see the good in others and you work well with people. They will give you the benefit of the doubt more often than not if you treat them with respect. And so, the art is how you both get along and not be afraid to disagree. And that is and how you have a fight, right? Some of my best times in the legislature were when I went at it with somebody on an issue, and then we, shook hands and maybe went and had dinner afterwards, and then teamed up on another issue. There's I always say, I have a lot of adages after all these decades, but I always say, be hard on the issues and easy on the people. Don't be afraid to push, but try to recognize that everybody in the space is just usually doing the best they can to try and further their cause. And more often than not, if you're committed for the long term and you do it in the right way, you can make a difference.
How do you as you speak, I have more questions in my mind than but let me ask you, how do you keep yourself, let's say you have a certain way you're thinking about an issue, right? And you're talking to a lot of people about the issue, and let's say it's mental health or substance use disorders, people who are unhoused. How do you keep your mind open once you feel like your idea is formed? Do you actively do something to keep your mind open to new ideas all the time?
Well, first of all, you have to be humble enough to know that you don't know everything. Even if you're an expert, you have to have that mindset. Secondly, I always say that it is important to do as much or more active listening when you're working with others than it is to talk, because you learn things from others. You might see the issue in a different way, or by listening, they might confirm your opinion on the issue that you are working on. You know, again, I mean, I think here's the other thing that it's good to be certain about principles and values. Like, for example, in the mental health field, I'm certain about my principle that the system must do a better job serving and helping people who are the sickest of the sick, and that we're not doing a good enough job in doing that. I have some specific ideas about how to change that, including, you know, my view that there ought to be a legal right to treatment and housing for Californians, but I'm open and have to be open to the idea that there might be other ways to increase access for those people who too often are getting passed over. And so you could be firm in your principles. I think you have to be open in terms of the means and the ways to achieve your principles.
Can you tell us a little bit about when you were in the assembly and then you were in the Senate, right? The experience of being in these two bodies. How different was that in terms of your oversight on things and your experience of working?
Well, they were the same and different. I mean, they are co-equal houses and they check each other. The obvious difference is that the assembly is twice as large, and the senators represent larger districts than the assembly members by two, by definition. And the cultures are different. And some of the traditions, for example, in the assembly, you vote electronically. In the Senate, it's a voice vote. That's one of many differences. They were different experiences for me, in part because of the chronology of my career. When I was elected to the assembly, that was the first exposure I ever had to the legislature. I had never worked in the legislature. So I was a newbie at the beginning of the term limit era. I was entrepreneurial. I worked hard. I didn't know really how it worked, you know, a little bit of fake it until you make it. And I chaired 4 major committees in 6 years, but wasn't ready to be the leader, I didn't think. And I served my 6 years, and then I got over to the Senate. By then I had had all this experience, and I was wanted to be and was ready to be the leader and ran for leader. And so my Senate years were different in that I was the one responsible during 6 out of my 8 years. And those were harrowing times, of course, the worst budget deficit in California's history, at least over the last 50 years. And my job was not to advance causes like mental health, but to protect much of what I and my colleagues had fought for decades, and to help the state achieve fiscal solvency again. And we did after 4 hard years. So my experiences were different, but you maybe make another point is that no matter what level of government one serves in, the skill sets are largely the same. It's a team sport. It is having your North Stars, your causes. It's figuring out strategically how to move closer towards your North Stars, and how to both push, but push in ways that don't alienate you from the people you are relying on to help you achieve your goals.
You also obviously, authored and saw through the landmark Mental Health Services Act.
First of all, before there was the Mental Health Service Act and Proposition 63, we did several major bills, AB 34 and 2034, and got up to $55 million a year to help 5,000 people through a program we called Integrated Services for the Homeless Mentally Ill. And that was the foundation for what are now known as full service partnerships, the wraparound service model under the Mental Health Services Act. We would never have gotten the Mental Health Services Act had we not only passed those bills, but actually demonstrated in real time that by helping people in the right way and not siloing the money, that we could significantly reduce days of homelessness, arrests, incarceration, psychiatric hospitalizations, because that then gave us the credibility to go to the voters and to put together an initiative. The initiative itself was a kind of a dream, and we really didn't know whether or not we'd be able to pass it. We raised the least amount of money necessary to pass a statewide initiative in 2004. We got a little lucky in that there were a number of other controversial initiatives on the ballot in '04, so we kind of went right under the radar. And we passed with 53% of the vote, but I think we also passed it because we were the first ones out of the gate with a tax on the wealthy millionaires. And secondly, we hit a chord with mental health because I think the voters said to us, we may not be talking much about it, and that was 2004, but everybody knows somebody. Every family is affected, and I think they wanted some hope. And the initiative, of course, has not been perfect, but it has generated $35 billion over 20 years. It has spurred so much innovation, helped 220,000 people through full service partnerships. And we need to do a better job cataloging what it has done. And of course, now it's Prop One after the voters, with my full support, modernized it in 2024 with the leadership of Governor Newsom and his administration. And now the money will be more focused, I think, on those people who we originally intended to make a priority, those people living on our streets, those people coming out of jail and prison.
I actually have worked in a full service partnership right out of my training in 2014. I worked there for about 4.5 years in Imperial County, and it is a incredible formative work experience for me. And it is a great program because I think the support the patient, obviously, but also the team had with each other made all the difference in caring for somebody who had such high level of needs.
It's the right concept, but there needs to be, I think we got more work to do. We want to create standards for, that say if you are this level of acuity, you're this sick, or you're out on the streets, you're entitled to this level of care. And if you're sick but less so and you're housed, maybe you get a different level of care. We need to create standards, quality access standards, and then quality standards for these wraparound service programs so that we're spending the money wisely and we're meeting people where they're at and giving them the best chance at success. And also how we move people out of these programs so that they can begin the transition to living more independently and creating then more room and more slots for the people who currently are on long waiting lists.
Some of the times, some of the policies, as they get implemented and get down to the local level, right, they may not be fully implemented in the vision that you had while
If
designing and writing it. What do you feel needs to change? I'll tell you something from my experience. I've implemented the SAMHSA CCBHC program and several other state funded programs within a community health center. But there's a balance between a policy or a program being too restrictive versus too open. How do you think about implementation of these policies?
implementation is everything. It's the most underrated part of government. I think government in general does not do accountability well in general. I think there's a new opportunity here to show that the relationship between the state, local government, and providers can be appropriate and balanced. The state should set the standards. Say, this is what we expect out of wraparound and FSP. This is who we not only want, but will hold you accountable to making sure that people who are, again, the sickest of the sick get actual access to these programs. And then let local government and the providers do it in whatever way they think will lead to the greatest success. And we haven't, sounds simple, but we haven't quite figured it out. Too much accountability is done retrospectively, where we look back and evaluate a program. I think upfront accountability says there needs to be legally binding standards. For example, our institute, the Steinberg Institute, sponsored the bill last year, the Maggie Krell bill, that created presumptive eligibility for people to be eligible for FS if they have a chronic mental illness and are living on the streets, that you're entitled to an FSP. And that's as close to a requirement as we could come. But I think there needs to be more of those kinds of standards. And not everybody, by the way, needs the highest level of care. There are people who need intermediate levels of care, but there is no real standard for differentiating and then requiring the systems to be able to match the person with their need. And I think that's the next level of work that we need to do around implementation.
Yeah, a lot of I think, incentives are for each program is built around what they do within themselves, whereas the value for the patient, for the individual, often comes from, is my system that's supporting me today able to help me transition effectively to the next level of care? And I think in most grants and resources are not often incentivizing that transition. And I think that's where it's missing.
Yeah. Lot room for a lot more outcome-based payments, and we tend to, distribute the money based upon the real need, but per capita or whatever, by incidence of homelessness or mental illness. There needs to be a much greater emphasis on paying for performance, and that's again sounds simple. In the government world, it's not nearly as simple, but it really is the right way to go about this. Is we want to incentivize helping people get healthier and then moving out and into various degrees of independence, depending upon their own need, their own lives.
Thinking through, your role as mayor of Sacramento and
Yeah.
especially the COVID years, right?
You had to remind me.
I apologize. But, like you were in this unique place where the role of the mayor, who's obviously focused on mental health, substance use disorders, unhoused people, but now you have this incredibly scary pandemic also on top of that. How did you think about your role and implement your role as mayor as it interfaced with public health, county, community-based organizations? Or how did you think about your role there?
Well, I think my role was to be both a convener of the various leaders in the public and private sectors, since, there was such an impact, for example, on small businesses, to convene the business community because the city was getting a lot of money, thankfully, from the federal government to help provide assistance. So it was really convener in chief. And then secondly, to be of reassurance and comfort to the community because people were understandably affected. I always say to people, how many of you suffered from anxiety or depression during COVID? And I said, for those of you who didn't raise your hand, you're not telling the truth because everybody did. So my role as mayor, even from my den, because a mayor is usually out in the community, but even in my den, it was about trying to reassure people that we and the county and others were on top of this, and that here's where you get help, here's where you get tested, and here is how we're going to get through this together. And we did, but it was a harrowing time for so many people. We lost so many lives, of course, number one. But even for a city like Sacramento, and this is true of other cities, our downtown got hollowed out. I mean, state workforce left and still hasn't come back. Economically and culturally, it just was incredibly challenging time, but not just for the city, for the state, the country, and the world. And mostly for kids who lost years of their education and the connection with their friends and with their teachers. I think we too easily dismiss the fact that we are still living with the impacts and consequences of COVID. I'll say one good thing.
Mm.
I think it raised people's awareness of mental health and mental illness. It was one of the spurs of elevating the discussion and creating more focus and intensity on how we help people, especially children, who really suffered and continue to suffer.
And telehealth also, I think, was an incredible output available across the board in every setting, has had an incredible impact on access. Even for people who live in urban areas, they often did not have access.
Telehealth is a positive revolution.
Right.
It really is. It's necessary. We when you think about what it takes to get to see a doctor, literally, right? And the fact that you can do it on a Zoom call and the doctor can be more efficient with his or her time. On the other hand, it's again a balance because telehealth does not often substitute for an in-person examination or in-person consultation. And we've got to make sure that we use the technology in an appropriate way, but not have it completely substitute for what it takes. Somebody needs to see a doctor in person.
If, I was at the Steinberg Institute's Vision for 2030 session recently. What is your vision for the Steinberg Institute for the next few years?
Well, I'm really proud that we've got a great thing going, and it's in my name, and I'm proud of that and humble about it. And I help a lot, but I don't run it. It's run very professionally by Karen Larson, who's our CEO and a great team. And we have the freedom of being able to sort of step back and say, what is it going to take to make the next great advance in behavioral health? And I will tell you that our focus increasingly is on what we talked about earlier, which is implementation of the laws that have passed, some of the groundbreaking laws that have passed over the last couple of years. Whether it is, of course, the big one, which is Prop 1 and the BHSA and the billions of dollars that are going to continue to flow, whether it's the Care Court and the Children's Behavioral Health Initiative, we've got to make these laws work. And the definition of making them work in the best way possible is that more people have ready access, and especially people who are languishing in unacceptable settings, right? And I mean on our streets, in our emergency rooms, in jails. We have got to make sure that these laws begin to make a real difference. And I know that's doable because who would have thought we've gotten as far as we've gotten, that there would be billions of new dollars infused in the system and so many more people would get help. That's what's happened. You know, it's not all bad. I got to always catch myself because I push so hard that I'm not just a naggy critic, that I'll acknowledge and recognize the great work that's being done. I just want it to be better.
Yep.
And I think we all do.
I'm currently working on building a comprehensive dementia care program. That is one of the areas I find are most fragmented in the care. Do you have any thoughts in that space on what needs to change?
Well, I think that all the brain sciences need to coalesce, and the co-occurrence between, for example, autism and mental illness, between the struggles of older Americans, including dementia and mental illness. There's a lot of crossover, and it's all about the brain anyways. So we need to be working together and to reduce the suffering, no matter what the diagnosis is, to reduce the suffering. Allow people, as we live longer, especially, to live higher quality of lives. What tragedy for people to live longer, to still have their physical bodies be in relatively good shape, but for dementia, right, to not be able to enjoy that into their later years. It's all about the brain, and we're making strides.
My last question to you, what is the most exciting and challenging?
I think the most exciting and challenging problem working on today is to take the foundation we have laid with all this new money and to actually build a system that was promised back 60 years ago, when the state shut those hospitals and said, we want to move to a system, a community-based care for people so that people could live independently in their communities while having challenges. That's the most exciting thing, that dream of taking this foundation that we have laid and actually creating a coherent system that's less fragmented, that's easier to access, and that helps more people. That's the most exciting thing that I'm working on and will continue to, because I don't think we'll solve it all in our lifetimes, but we sure ought to make it better.
Yeah, as long as we keep working on it. Thank you, Mr. Steinberg. I truly appreciate your time today. And
Dr. Mishra, it's great to be with you, and thank you for all the good work you're doing, okay?
thank you so much.